Today's title reveals a silent but serious danger, the most common egg-eating mistake that harms elderly health. Main health problem: high cholesterol, arterial inflammation, and accelerated heart disease risk in seniors. Promised solution: one simple but critical change in how eggs are prepared and consumed. This matters because after age 60, the body handles fats and cholesterol very differently. A small daily mistake can quietly increase the risk of heart attack, stroke, and memory decline, but the right approach can turn eggs into a powerful protective food. Every year, millions of seniors believe they are eating healthy, yet unknowingly damaging their hearts. Medical data shows that over 65% of adults above 60 have elevated LDL cholesterol, and one common breakfast habit plays a major role. Ignore this mistake, and plaque builds inside arteries, blood pressure rises, and oxygen to the brain drops. The result? Loss of independence, sudden cardiac events, and faster cognitive decline, all from a food eaten almost daily. Dr. Michael Aronson, a preventative cardiologist with 32 years of clinical experience, has treated over 18,000 senior patients. He reports that nearly 70% showed cholesterol improvement within months simply by correcting how they consumed eggs. His conclusion is clear: eggs are not the enemy, the mistake is. As we age, liver cholesterol clearance slows, and arteries become more sensitive to oxidized fats. When eggs are cooked improperly or paired with the wrong foods, cholesterol becomes oxidized, triggering inflammation inside blood vessels. This inflammation accelerates atherosclerosis, the root cause of heart attacks and strokes. Mistake number 1: frying eggs in butter or refined oils. Scientific danger: creates oxidized cholesterol that damages arteries. Study data: a 2021 cardiology review linked fried egg consumption to a 17% higher cardiovascular risk in seniors. Patient story: a 68-year-old patient saw LDL drop by 24% after stopping fried eggs. The safe egg protocol for seniors. Scientific benefit: boiled or lightly poached eggs preserve protein and reduce oxidation. Study result: seniors eating boiled eggs 4 to 5 times weekly showed improved HDL and no LDL increase within 8 weeks. Action plan: boil or poach, never fry. Limit to 1 egg per day. Pair with vegetables or fiber, never processed meats. If you're over 60 and care about your heart, memory, and independence, like this video, subscribe, and comment your age below. This channel is dedicated to senior health, prevention, and longevity. One small change today can protect your arteries, sharpen your mind, and keep you independent for years to come. Smart food choices mean fewer hospital visits, lower medical bills, and a longer, stronger life. Subscribe now and take control of your health before it's too late.